The Doctor's Ghost.
It sounds like the title of a Victorian mystery novel, doesn't it? Something to read by candlelight.
It really does. But we're not talking about haunted hospitals or spirits roaming the hallways today. We're talking about a different kind of ghost.
A much more modern one.
Exactly. We're unpacking a fascinating piece of source material we found called The Doctor's Ghost, which is actually a script, a fictional duel of logic, where AI personas debate the absolute cutting edge of the future of medicine.
And what makes this script so compelling for a deep dive is that it isn't just science fiction. It acts as a perfect framing device for a very real, very high-stakes battle happening right now.
To make sense of it, we've cross-referenced the script with a whole stack of documents, a strategic analysis of the healthcare AI wars between Anthropic and OpenAI, a pretty dense FDA report on generative AI safety, and even a clinical study on how these models handle mental health crises.
So the mission today is to figure out who wins this argument.
Right. On one side of this script, we have the move fast and fix things crowd. On the other, the do no harm crowd.
And the question is, are we about to fix a healthcare system that, let's be honest, everyone agrees is broken?
Or, by unleashing these AI models, these ghosts in the machine, are we about to break it even further?
It's the ultimate risk-reward calculation. And I think the best way to understand it is to look at the characters in this Doctor's Ghost script. They aren't just characters. They're like avatars for these trillion-dollar philosophies colliding in Silicon Valley.
Okay, let's jump right in then. First up is a character named Maverick Mike.
Maverick Mike. He's based on the DeepSeek model in the script. He is the disruptor. He's basically Silicon Valley personified.
And he comes out swinging. I mean, reading his lines, his main argument is that we don't have time for caution because the current house is already on fire.
Right. He points to the data, which, by the way, we see validated in the Token Ring AI report we have, that healthcare is a $4 trillion system where administrative inertia is literally killing people. He talks about something called pilot fatigue in hospitals.
Pilot fatigue.
Yeah, it's this phenomenon where hospitals run dozens of these small AI experiments that, never really go anywhere. Meanwhile, hospital boards are obsessed with ROI because insurance claim denials and physician burnout are costing them billions. Mike's argument is bureaucrats make more decisions than doctors do right now.
So if you're worried about AI making a mistake...
Look around. The human system is failing patients every single day.
He's basically saying, while we're waiting for perfect evidence, people are dying.
It's a compelling point. But then you have his opponent in script, Dr. Victor Hartman.
Dr. Hartman. He's based on the Claude Opus model. He is the guardian at the gate, the do-no-harm principle incarnate.
And he is not having any of Mike's move-fast attitude.
Not at all. Victor's counterargument is that high accuracy isn't enough if false positives flood the system.
Right.
If an AI flags every little shadow on an X-ray as potential cancer, you aren't saving lives. You're overwhelming the system with unnecessary biopsies. His line in the script is, ship it and iterate is dangerous for human bodies. You can debug code later. You can't debug a patient.
Exactly. Which brings us to the core technical problem, the actual ghost in the title. We have an FDA report in our source stack that backs Victor up completely on this. They talk about the unique risk of generative AI being hallucination.
Hallucination is the ghost. And it's important to define this because it's not like a normal software bug.
Not at all. In traditional software, if there's a bug, the program crashes or it gives you an error code. Generative AI doesn't crash. It confabulates.
It makes things up.
But it makes them up plausibly. It'll generate a diagnosis or a treatment plan that sounds incredibly professional. It uses the right medical jargon, the right tone. It might even cite studies that look real but just don't exist.
That is the ghost. It looks like a doctor, sounds like a doctor, but there's no medical reality behind it.
And the FDA report brings up another concept. Unlocked models. This seemed to be a major sticking point for Dr. Hartman in the script.
What exactly is an unlocked model?
This is the regulatory nightmare. Traditionally, a medical device is static. You build an MRI machine, you test the software, you lock it, and you ship it. It works the exact same way on day one as it does on day 1,000.
Consistency is key in medicine, right?
Exactly. But generative AI is designed to learn and adapt. The FDA points out the difficulty of regulating a system that changes after it's deployed.
So, an AI model could update its internal logic on a Friday afternoon based on new data.
And suddenly on Monday morning, It starts giving slightly different advice than it did last week.
So you could have two patients with the exact same symptoms getting different diagnoses just because the software updated over the weekend.
Precisely. That is the unlocked aspect. It's unpredictable. And if you can't predict it, you can't regulate it, and you certainly can't trust it with life or death decisions. That's why Dr. Hartman calls it a ghost. It's constantly shifting shape.
It's the difference between a scalpel and a scalpel that decides on its own to become a spoon halfway through surgery.
That is a vivid way to put it, but yes. And this whole philosophical debate in the script, Mike wanting to disrupt the bureaucracy versus Victor being terrified of this unlocked ghost, it's actually playing out in the corporate strategies of the biggest AI companies.
Right. We have that fascinating analysis from LBZ Advisory that breaks down the war between OpenAI and Anthropic.
And they're fighting completely different battles. The analysis calls this the horizontal play versus the vertical play.
Okay, let's look at OpenAI first, the horizontal play.
So OpenAI with ChatGPT is horizontal. They're going bottoms up. They have, something like 230 million weekly users. Their strategy is broad consumer adoption.
So they want patients using ChatGPT to check their symptoms, to understand lab results, things like that.
Exactly. The patient brings the AI into the exam room, and the LBZ advisory source notes this creates a massive risk they call demand management.
Demand management. That sounds like corporate speak for making doctors' lives harder.
It basically is. It creates friction. Imagine millions of patients showing up to their appointments, armed with AI advice, challenging their doctors, saying, well, the AI said my blood work means this.
Oh, that sounds like a nightmare for an already burned out workforce.
It floods the zone with information that the doctor then has to spend time verifying or debunking.
Okay, so what's the alternative?
The alternative is the vertical play, which is what Anthropic, the makers of Claude, are doing. And this aligns perfectly with Dr. Hartman from our script.
They aren't trying to win the consumer.
No, they're selling to the enterprise, to the hospital CIO and the chief medical officer.
The Token Ring AI source calls Anthropic the Switzerland of AI. I love that phrasing. What does that mean in practice?
It means neutrality and safety. They promise a zero training policy.
Which means?
It means they don't train their models on your private patient data. If a hospital uses Claude to analyze records, that data doesn't get sucked back into the global brain of the AI. It stays private, which is, critical for HIPAA compliance.
And they also talk about connectors.
Yes. This is their answer to the hallucination problem. Instead of just letting the model guess, they build these connectors to the source of truth, like the PubMed Medical Library or the ICD-10 coding systems.
So when Claude answers a medical question, it doesn't just improvise, it has to cite its sources.
It shows its work. It provides an audit trail. The strategy here is to be the middle office plumbing, handling the coding, the billing, the complex analysis, rather than just chatting with patients. It's safety baked in versus safety as an afterthought.
Okay, so we have the move fast consumer model and the safety first enterprise model, but strategy is one thing, performance is another. We have to talk about this mental health stress test.
Yeah, this was from the Arquette's Beef clinical study in our source stack, and honestly, this is the most disturbing part of the research for me.
What did they do?
The researchers tested 6 different models: Claude, ChatGPT, Gemini, Grok on high-risk mental health disclosures. We're talking suicide ideation, domestic violence, self-harm.
They wanted to see if the AI would recognize, hey, this is a crisis, I need to stop acting like a chatbot and act like a safety net.
And there was a clear winner. Claude scored a perfect 1.0 on explicit acknowledgement of risk. It recognized the danger every single time and pivoted to providing resources.
And the others?
Not so great. Grok, ChatGPT, and Llama all scored below 0.5. They missed the risk factor more than half the time. But here is where it gets really interesting and technically quite scary. The study highlighted something called the empathy trap.
The empathy trap, that sounds manipulative.
It is, in a way. It refers specifically to how ChatGPT performed. The study found that ChatGPT scored perfectly on empathy. The language it used was incredibly caring, warm, supportive. It sounded like a really good friend.
There's a but.
But it failed to consistently provide specific resources or encourage help seeking.
So it's the friend who listens to all your problems, validates your feelings, says, oh, that sounds so hard, but just lets you stay in a dangerous situation.
That is the trap. It validates your feelings but doesn't move you towards safety. The user feels heard, which releases dopamine, so they keep talking to the bot instead of calling a professional. It's a model optimized for conversation, for sounding human, not for clinical safety.
That connects right back to that token ring source talking about constitutional AI, the idea that safety has to be part of the model's DNA, not just a filter they slap on top.
He does. But we can't just talk about the high-tech hospitals and the perfect models. We have to talk about the reality on the ground.
Right. And in our script, there's a third character we haven't met yet, Marcus the Mayor Johnson.
Marcus is crucial. He represents the neighborhood clinic reality. He's based on the Claude Sonnet model, lighter, faster, cheaper. He's not at the Mayo Clinic. He's in a clinic on 63rd Street with one overworked radiologist and, spotty Wi-Fi.
So Marcus brings the equity argument into this, and it complicates everything.
It really does. He argues that demanding perfection waiting for Dr. Hartman's rigid clinical trials actually creates a two-tiered system.
Because while the rich hospitals wait for the perfect AI, the under-resourced clinics get nothing.
Exactly. And we see this concern in the real-world sources, too. The WHO has raised flags that the benefits of AI might only reach wealthy nations, widening the health equity gap.
And we saw that Reddit thread with actual doctors who are really skeptical about for-profit companies barreling past the FDA. They're worried about patient data becoming a cursed artifact.
But Marcus flips that argument in the script. He says, don't use us as guinea pigs, but don't lock us out either.
He calls for early access as resource leveling.
Right. His point is, if you have 0 specialists in your neighborhood, an AI that is 85% accurate is infinitely better than no doctor at all.
That is a dangerous calculation, though. I mean, 15% wrong is still a lot of error.
It is.
Yeah.
But Marcus argues that if you wait 10 years for the AI to be 99.9% accurate, you've condemned a decade of patients in his neighborhood to substandard care because they couldn't see a human doctor either. He views the AI as a force multiplier.
So how do they resolve this in the script? You have Mike wanting speed, Victor wanting safety, and Marcus just wanting something that actually works now.
They actually come to a synthesis that, fascinatingly, mirrors the best recommendations from our real-world FDA and advisory sources. They agree on a hybrid solution.
Okay, break that down for us. What does the compromise look like?
First, technical feasibility. Maverick Mike, the disruptor, agrees to stop talking about massive cloud infrastructure. He pivots to edge computing.
We should probably define that.
Sure. Cloud computing sends your data to a massive server farm to be processed. Edge computing means the processing happens right there on the device, on the tablet or the phone.
So it's faster, it works without internet?
Which solves Marcus's Wi-Fi problem. And it's more private because the data never has to leave the room.
Okay, so cheap local hardware. What's next?
Second, Dr. Hartman gets his win. He demands confidence scores. Right. The AI can't just say, this looks like cancer. It has to say, I am 87% confident this requires follow-up based on these 3 specific anomalies. Yeah. It has to show its work.
It stops being an oracle and starts being a tool.
Exactly. And finally, Marcus gets the human in the loop. He insists on community testing. He wants the nurses to try to break the prototype before the full rollout. He refuses to let Silicon Valley just drop it on them from a helicopter.
You know, it's funny because that sounds exactly like what the FDA source calls the total product lifecycle approach.
It is. The FDA has realized you can't just approve an AI once and walk away. You have to monitor its performance after deployment. You have to see how it acts in the wild. This TPLC approach acknowledges that the software will change, so the regulation has to be continuous.
It seems like the biggest takeaway here is that the choice isn't really AI versus human.
No. The script ends with Dr. Hartman admitting that the absence of perfect evidence is not permission to do nothing. The choice isn't AI or doctor. The choice is AI-assisted human versus overwhelmed human.
I love that phrasing. AI-assisted human versus overwhelmed human. Because, let's face it, the humans in healthcare are definitely overwhelmed.
And here's the provocative thought to leave you with. The LBZ advisory source suggests AI is becoming the cognitive infrastructure of healthcare. We already have 230 million people using ChatGPT weekly.
That cat is definitely out of the bag.
It is. So the medical community no longer gets to decide if AI enters the exam room. It is already there. It's in the patient's pocket. The only question left is the doctor listening to the patient or is the patient listening to the ghost?
That is something to chew on. Is the patient listening to the ghost? It sounds like we better make sure that ghost knows what it's talking about.
Absolutely.
That's it for this deep dive into the doctor's ghost. Thanks for listening.